This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager, Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, everyone. I am pleased to welcome you to another Ministry of Health virtual media conference where we provide the latest information on the Ministry's COVID-19 measures and all ongoing efforts to safeguard the health of our nation. Today we have with us the Honorable Terence Dayal Singh, Minister of Health, Dr. Miriam Abdul-Richards, Principal Medical Officer of Institutions at the Ministry, and Mr. Davlin Thomas, Chief Executive Officer of the North Central Regional Health Authority. I'm Candice Alcantara, Manager Corporate Communication and your moderator this morning. Today is Wednesday, 7th of April, and it's World Health Day. The theme for this year is Building a Fairer, Healthier World, which is quite apt considering the international developments related to COVID-19. And now I invite the Minister of Health, who received his vaccine yesterday, his COVID-19 vaccine yesterday, to begin this morning with his opening presentation.
Thank you. Thank you very much, Candice. Good morning to Dr. Miriam Richards. Good morning to the CEO of North Central RHA, Mr. Davlin Thomas. Very pleasant morning to ladies and gentlemen of the media and to all persons who are listening and viewing on the different platforms. Yesterday, April the 6th, 2021, is probably the most significant day in the history of Trinidad and Tobago when it comes to public health and public health interventions. In facing down a global pandemic, which is now seen to be a 1 in 100-year event, we started our national vaccination plan. So that in itself is significant. I want to thank everyone at the Ministry of Health and the 5 RHAs, 4 in Trinidad, 1 in Tobago, who worked with us, who planned sleepless nights, worked over the Easter weekend to have a successful rollout yesterday. Yes, there were some operational issues, as you can imagine, and we will face those down. But by and large, yesterday was a tremendously successful day. What are some of the positives that we could take out from yesterday? One, that the public has faith in the vaccine, that there's a high level of vaccine acceptance in Trinidad and Tobago. That means we have an informed and intelligent public, and I want to congratulate the public. I want to really congratulate Mr. and Mrs. Trinidadian and Mr. and Mrs. Tobagonian. We will address the operational issues, and we have 2 persons this morning who can speak to that. Yesterday, I took the vaccine myself, leading from the front, as we say, with healthcare workers, and I am totally glad to have been vaccinated. I personally trust the vaccine and have faith in the vaccine. Otherwise, I would not have taken it. Based on that, I want to encourage more and more people to take the vaccine as we get more and more vaccines and we roll out more and more sites. I am sure one of the questions I will be asked, did I experience any side effects? And the answer is no. For whatever reason, I don't know. I had no fever, no headache, nothing. I spent a comfortable night. I have no pain in my injection site. So I am perfectly fine, but we do know some people experience some minor side effects, and that is not to be minimized. But as the doctors will tell you, you just take your little paracetamol and you get over that 24 to 48 hour hump if you get any minor side effects. So far, we have administered over 2,000 vaccines, including yesterday, and I will give you the breakdown now, plus what we started with healthcare workers. And so far, in our sort of analysis of the trends, so far with those 2,000, we have not noticed any adverse effects. There have been some side effects, but no adverse effects. Those individuals who have had some side effects, as you had Nurse Privat here attesting to, and the doctor from Dr. Don Martin from Couva a few weeks ago, they did attest to some side effects that may have laid them a little bit low for 24 to 48 hours, but once they got over that, they are fine. At this point in time, I would like to give you the breakdown of the numbers across the 5 RHAs that we administered yesterday. At Northwest RHA, we administered 80. And let me just remind the public, within the next week or so, we'll be bringing on 3 more sites under the Northwest RHA. NCRHA, and Mr. Davlin Thomas is here, they administered 280. Southwest RHA, which is a very populous area, 471. ERHA, 171. And TRHA, 151. These are the figures as of 6 p.m. yesterday, giving you a grand total of 1,153. So the initial target that I was hoping to achieve by the end of the first week of 1,000, we made it on the first day, and I hope we continue with these numbers and actually even do better. So we have done 1,153 vaccinations yesterday across the 5 RHAs. So we have met our target and even beaten it by about just over 10%. So that's a good sign. And as I say, we'll be adding some more sites within the next 7 days or so under Northwest RHA. Let me explain the rationale why we could not bring more sites under the Northwest RHA. When the team, led by the CMO and including the RHAs, visited some of the sites in the inner city like Oxford Street, George Street, and Woodbrook, they found that these health centers, because you are in the city, they either had no parking or inside was simply too small to accommodate a safe amount of people being vaccinated. So we didn't want to delay the project while we brought on 3 more sites. So we have been working over the past couple of weeks, and we have looked at 3 other sites. I will inform the persons in and around Port of Spain and the media, hopefully by Saturday, when we have that concretized, so our numbers under Northwest RHA should then go up significantly. So that's my little update for this morning, and I want to congratulate everybody. Today is World Health Day. Today is a significant day, coming a day after the start of our vaccination program. So it's very apt that we celebrate World Health Day today, a day after we started our vaccination program, targeted to healthcare workers and those most vulnerable in society. So we are happy for that. That's my report this morning, Candice. Over to you.
Thank you very much, Minister. And we now invite Dr. Miriam Abdul-Richards to give us the clinical update and also address some other matters related to the COVID-19 vaccine rollout.
Thank you ever so much, Ms. Alcantara, Honorable Minister, my colleague, CEO Davlin Thomas, members of the media, and good morning, Trinidad and Tobago. This morning, I'd like to provide the clinical status update, an update on the repatriation process, as well as a summary of the current epidemiological clusters and the rolling average as per week 13, which is accurate up until week 13 of the report. As of 4 p.m. yesterday on April 6, 2021, media release number 686, there were an additional 22 positive cases of COVID-19 that were confirmed. This takes the number of active cases to a number of 392 positive cases, which are distributed as follows: 325 persons in home self-isolation and 38 persons in hospital. The breakdown of persons in hospital is as follows. At the Cora facility, there are currently 8 COVID positive cases. At the Couva Medical and Multi-Training Facility, 17 cases, of which 14 are ward level and 3 are ICU patients. And at the Scarborough Regional Hospital, there are 13 cases at this time. At the day-based step-down facility, there are 7 persons who are in step-down care and being managed. Thus far, the number of persons tested has been 114,420, with a total positive cases of 8,214, and we have had 145 deaths so far. We would like to extend our condolences to the family members of the deceased at this point in time. As of 8 a.m. this morning, there are 251 persons in state and state-supervised quarantine, and that is spread over 13 facilities and some vessels in which we work with the essential services sector. On April 8, which is tomorrow, we have an upcoming repatriation exercise, and thus far as of this morning, there were 120 ticketed persons. Approval was granted for 140 persons, and we expect a turnout by this evening of about 130 persons. Again, the Ministry of Health and the Ministry of National Security work in collaboration with each other to ensure that there is a safe return of all nationals abroad as well as persons within the essential services sector. We have 3 more upcoming repatriation exercises within the next 2 weeks from Canada, Toronto, Canada to be exact, from Barbados, and from Miami, USA, with an average number of persons of about 140 per flight. I would really like to recognize the efforts of all concerned in terms of the logistics and the exemption process for the repatriation of returning nationals. We are trying to ensure the safe return of our nationals, and we would like to thank all nationals and their families for their patience. I'd like to now speak about the trends that we have noticed between the beginning of January and this week. And let's start with the hospital occupancy levels. We have seen the hospital occupancy levels increase from week 1 or the first week in January from 2% to this week where we have increased up to 13%. That increase really started around week 11, which was about 3 weeks ago, when we noted an increased number of cases that has been consistent over the last 3 weeks or so. Also, the rolling average number of cases was approximately 3 at the beginning of the year and held constant till about 3 weeks ago. As of this week, the rolling average has increased tenfold from 3 to 30. And when I speak about that term rolling average, I'm referring to the average number of cases per day, which is collated on a daily basis by our epidemiology department. The overall spread or transmission of the COVID-19 virus has been mapped by our epidemiology and our GIS department. And what we've noted over the last 3 weeks is a shift in the transmission of cases from the central and south region now into the east-west corridor. It means that we are now seeing a national or transmission of the COVID-19 virus throughout the country. So it's no longer restricted to the central and south regions, but now going onto the east-west corridor with a similar prevalence rate or a similar number of cases as the central and south areas. This really emphasizes the need for all of us to exercise our COVID-19 mitigation measures, in terms of protection for the COVID-19. Now, I'd like to remind members of the population that also although we've had a successful rollout of the vaccine starting yesterday for members of the population, the COVID-19 vaccine is just an additional layer of protection for persons and for our population. Additionally, I would like to remind persons who have been vaccinated to continue with their COVID-19 measures or measures to reduce the COVID-19 virus. So you need to continue practicing the 3 W's, which are watch your distance, wash your hands, and wear your mask properly. Despite the ability of the parallel healthcare system to really have higher occupancy levels and its resilience, as well as the onset or commencement of the COVID-19 vaccination drive by the Ministry of Health, we need to be cognizant and exercise our personal responsibility in terms of reducing the transmission of COVID-19. And as I close, I would like to again appeal to members of the population on behalf of the Ministry of Health and the government to continue practicing the 3 W's. Let's all wear our masks properly. Let's watch our distance and let's wash our hands. And of course, if you're ill or unwell, please stay at home and contact 877-WELL for testing. And let's protect our families, our staff members, our workforce, and members of the population. Thank you.
Thank you very much, Dr. Richards. And today we begin a series of interviews with chief executive officers from the regional health authorities to bring us all up to date on the COVID-19 vaccine rollout in the facilities under their remit. We begin this series with Mr. Davlin Thomas, CEO of the North Central Regional Health Authority.
Honorable Minister, Dr. Richards, Ms. Alcantara, members of the media, happy World Health Day. Yesterday we had a very engaging and exciting day. We, as the minister indicated, we would have vaccinated 280 persons. That consisted of staff and non-staff vaccinations, which the breakdown though is Chaguanas Health Facility, 78, St. Joseph Enhanced Health Center, 76 persons, Arima District Health Facility, 55 persons, La Hoqueta Health Center, 71 persons. It was critical for us to ensure that we had contingencies in place, the structure in place to facilitate the vaccinations. Those are a lot of the rollout plans. Prior to the vaccinations yesterday, persons with NCDs would have been targeted and called. Appointments were made to ensure that they were there for the appointments. We had an extremely high vaccine acceptance, as the minister would have mentioned. That resulted in a number of persons as well showing up at the facilities to have appointments. Simultaneously, we would have been managing an increased number of calls to the hotlines that we would have identified on the ministry website. So there are some improvements that we will put in place by the end of day today. There will be other telephone numbers that persons would be able to call to ensure that they can have their appointments made. That is simultaneously while we call our usual NCD patients to continue generating appointments for them. In addition to that, we anticipate during this week we will build capacity by providing other pre-registration possibilities online as well, parallel to the one that is being placed, engaged at the ministry level. The hotline, the numbers for the Chaguanas area, for example, are 378-4374. St. Joseph, it's 378-3707. La Hoqueta, it's 380-1844. And at Arima, it's 380-1844. And La Hoqueta, it's 380-1704. We anticipate we will be continuing throughout this week with the improvements in the system as we go. We were looking at the numbers. It seems today we've already see at the Arima Hospital health facility, we already have 40 persons vaccinated. At Chagonas, over 40 persons vaccinated, which is an increase already from yesterday. St. Joseph, we have about 30 persons already, and La Joqueta, we're in the 20s. So we anticipate that we will have increased numbers as we go along. In addition to that, the calls that are coming in for appointments are approximately around 250 to 275 per line. Those are the appointments that are being made on a daily basis. Thank you, Minister.
Thank you very much, Mr. Thomas. And we go now into our question and answer segment. Media representatives, it's your turn to direct questions to the panelists. And we remind you, state your name and the name of the media house that you represent before asking 2 brief questions, please, and ask both questions at the same time. This morning, we begin with questions from TTT. I'm sorry, Mr. Lala, can you start again? We didn't hear you at the beginning.
Yes, hi, good morning again. Sonal Lala, TTT News. To the Minister, I know there was confirmation yesterday that the Indian vaccines are due to arrive next week. Do you have any information as to the expiration dates, and if these vaccines would be used as the second dose for some of them, if a portion would be used? And second question, we've gotten reports of a long wait time to call to register for the vaccines, somewhere between 1 or 3 hours in some circumstances. Is the system overwhelmed at this point in time, and are there any systems in place to be implemented to reduce that wait time? Thanks.
Thank you. So I will take the first question, and I will leave the second question to the operations experts. So we expect the 40,000 doses from Serum Institute of India on Monday, as indicated. Before I answer your question, I really want to thank everyone who was involved in this, from the Honorable Prime Minister, who wrote his counterpart, Prime Minister Modi of India. So thanks to both Prime Ministers. There's an unsung hero in all of this, and that is our High Commissioner in India, His Excellency Dr. Roger Gopal. That High Commissioner worked literally day and night across time zones, he and his staff. It was really a team effort between His Excellency Dr. Roger Gopal, my colleague Dr. Amory Brown, and a lot of thanks have to go out to them. Yes, to answer your question, we do not yet know the expiry date, and that is why we can't make any firm decision as yet as to its usage. As the CMO would have explained, when we got the COVAX shipment, it is only when it arrived we knew what the expiry date was. So at this point in time, I have no advanced knowledge of what the expiry date is. The only information we have, for which we are thankful, is that the 40,000 doses are coming in next week, Monday. So we wait. Okay? Thank you very much, Sonal.
And we go to Dr. Richards to begin answering the second question, and maybe Mr. Thomas may jump in as required.
So thank you, Sunil. First of all, the RHAs all had persons conducting site visits and observing the vaccine administration process. The Ministry of Health also had a team that was on site at all of the health centers to really understand the constraints, to mitigate risk, and to also put in systems to improve what was going on yesterday in terms of vaccine administration. The long waiting times has been identified as a challenge, more so in some RHAs than others, and that's really due to really a high level of vaccine acceptance, which we look at as a positive out of the vaccine deployment process, and also based on the populations of the health of the particular RHAs. So, for example, RHAs with a high population density, such as the SWRHA, which covers close to 600,000 persons, obviously had a higher demand for the vaccines in terms of the call. calls. So yes, we have received concerns from members of the population regarding the time taken to reach the hotlines, and also regarding the persons who would have entered or gone into the health centers to make appointments themselves. Just to let you know about the high level of interest in this vaccine, Diego Martin Health Center alone had over 600 persons coming in to make appointments on a phased basis, of course, yesterday. So processes have already been instituted across all RHAs. The Northwest RHA, they have increased the number of lines to 5 lines, and they've increased staffing for persons to communicate with members of the population based on the appointment system and the expected wait time. At the Southwest RHA, they have gone from 4 lines to 8 lines as of this morning to really increase that sort of communication and the efficiency of the process. We are in the process of increasing staffing levels by Friday of this week so that the lines are properly manned, and also we are having staff such as physicians and nurses manning the lines as well, so all concerns and questions about the vaccine can be answered at that time. The Ministry of Health is also looking at an online system within the next week that would really increase the accessibility of the vaccine and access with respect to a more efficient appointment system. At the NCRHA, I'm going to pass over to CEO Thomas because he will give you a really up-to-date and operational update regarding the systems that have been put in place to increase the number of calls and the efficiency of the appointment system.
Just to emphasize that the persons who actually had appointments are generally seen or receive their vaccinations around the time of their appointments. So that we felt was going pretty smoothly. What that person can expect do is that post-vaccination, just after you've had the vaccination, there will be a 25 to 30 minutes where we will take you to a treatment room so that you'd be observed for the 25 to 30 minutes. So you need to cater for that kind of time as well. The appointments is where we saw the high or the extremely high vaccination number of persons who accepted taking the vaccines implied that we had large numbers of persons who showed up. We increased the capacity for us to be able to deal with those, particularly those persons who just came off of the street, and simultaneously to engage the calls, those numbers of calls. We will increase as well the number of lines or phone lines that will become available to persons for each facility to call by this afternoon. But simultaneously, we're improving we've already increased the capacity to engage the growing number of persons who are showing up at the facilities, and increasing simultaneously the pre-registration capacity via the internet, and simultaneously the number of telephone lines available that will be available.
Thank you very much, Dr. Richards and Mr. Thomas. And we're very happy for all of this interest and quite high levels of vaccine acceptance at this time, and we will continue to adjust as we move forward. We go next to 98.1.
And good morning to you, Ms. Alcantara, Minister Dayal Singh, Dr. Richards, and of course, Mr. Thomas. Stephen Cummings, 98.1 FM. My 2 questions, one for Dr. Richards and the other for Minister Dayal Singh. I'll start with Dr. Richards. Dr. Richards, you mentioned the virus taking on a different spread, moving from central Trinidad to the east-west corridor. And there is a concern as to whether we have capacity where bed space is concerned, because I know that traditionally there's always been the narrative of not enough beds in certain areas. So that the question is, do we have that capacity in terms of bed space in anticipation of an overflow, if ever God forbid that we get to that point. And the next question, Minister Dayal Singh, there was, as you know, a report which came to us after the Prime Minister would have contracted COVID-19. We just wanted to get an update as to whether there was any further development by way of reports that would have come to you, just basically getting an idea as to his condition at this time. Thank you.
Okay, thank you. So I'll take the second question first, and part of the first one. Mr. Cummings, there was never a time in the past year with our COVID response where we ever ran out of beds. So I just want to correct that. And let me just say it again. There was never a time when a COVID patient who needed a bed, ICU, HDU, ventilator, did not have access to it. Dr. Richards will expand on that. 2, on the issue of the Honorable Prime Minister, as I said yesterday, the Office of the Prime Minister will send out bulletins, as they have done in the past, keeping the country appraised of the progress that the Honorable Prime Minister is making. I can confirm that he did make a social media post on his Facebook telling the country how he is, and I can refer you to that. Thank you very much.
Thank you, Mr. Cummings, for your question. Again, I would like to emphasize and reiterate the Honourable Minister's statement, which confirmed that there has never been any sort of challenge with respect to bed spacing and bed occupancy since March 12, 2020, when the COVID-19 national response and the parallel healthcare system was initiated. At the peak of community transmission between July and October of last year, when we had the most cases and the highest rolling average, we did not go beyond 60% overall hospital occupancy. Now, at this point in time, we have 6 hospitals that have been operationalized that are designated specifically for the management of COVID-19. Of course, given the overall low hospital occupancy rates between December and February, AREMA was returned to the population for use under the traditional healthcare system. At present, there are approximately 330 ward-level beds that are accessible across these 6 hospitals, 30 ICU beds, which can be upscaled to approximately 90 beds because we do have the ventilators, consumables, staffing, and PPE to support this, and 57 high-dependency beds. As far as step-down facilities are concerned, the Debe Academy has a bed capacity of approximately 90 for step-down patients, and there's a high level of interoperability that's been built into the parallel healthcare system. So other quarantine sites can be switched from, let's say, a quarantine site to a step-down facility to manage an increased number of cases. So just to summarize and to respond to your question, Mr. Cummings, the increased spread is extremely worrisome, and we would like to ask persons in the population to be very vigilant. However, the parallel healthcare system at this point in time on hospital occupancy is at 12 to 13%, and so we are confident that it is resilient to withstand the increased number of cases. Thank you.
Thank you very much. And we go to CL Communications, please. Are we ready with CL Communications?
Hi, good morning, everybody.
Wonderful. Good morning.
I just wanted to find out, this came from the members of the public, and they had asked through the radio station here that the landline number for booking an appointment to have the vaccinations is a home line. Now, that's a claim by the members of the public. So I was just wondering, is this true and is this being looked at? That's my first question. My second question is that there are temporary nurses who are going to be used to do the administering of the vaccinations. I was just wondering if the minister is aware of this and if any move is going to be made to change their contract to more permanent positions. Thank you.
Okay, so I think that is a question, more a very good operational question. That do you have the number that people are claiming is a home line so we could assist? Without knowing the phone number you were speaking about, it is difficult to assist. But it is not our policy to have home numbers. It could be a number that is close to somebody's home. That's a possibility. But without you giving us the number, either offline or off camera, it's difficult to really respond to that. On the issue of nurses, I will turn you over to Davlin Thomas.
Currently, the nursing staff that are providing the service, the vaccination service for us, they are DHVs. Those are very senior persons who are intrinsic to the system currently. We will be provided with additional support subsequently as the numbers rise. But currently we do not have primarily any temporary persons who are providing that service. Those are DHVs, and as I mentioned, very senior nurses in the system. Those are district health visitors.
Thank you very much. And we go now to AZP News, please.
Hi, good morning, Priya Bihari, azpnews.com. I just wanted to add, there have been reports to us that in Northwest RHA, their lines are a bit overwhelmed. We ourselves have called, and we are getting to go to get to make a recording, and secondly, the operator is not answering. So I know that is an issue. I just wanted to put that on record. And my second issue has to do with the has the contact tracing been done to see where this new upsurge has come from? Is it has it been traced to a certain event or a certain behavior? Thank you.
Dr. Richards.
And Dr. Richards will respond.
So thank you very much, Priya, for your feedback, which is indeed very helpful in us improving the vaccine rollout and the entire vaccine deployment process. So yesterday, the CEO and the executive team of the NWRHA actually had a review meeting in the evening, up until late in the evening, to identify the deficiencies, gaps, and challenges. We would like to reiterate that this is a learning process for us, and we are in the business of continuous improvement. Subsequent to that, and based on feedback from staff members and from the population, we have additionally worked on having an additional 3 to 4 lines that have been instituted as of this morning. We also have ramped up training and staff to basically have a better communication with members of the population. So we are hoping that this issue will be resolved within the next 48 hours. This has been a major item for the improvement of the process at the NWRHA. And again, it reiterates and emphasizes the high levels of vaccine acceptance, for which we are very grateful. With respect to the contact tracing for the increased number of cases, that falls under 2 areas. The primary contacts, which are the relatives and persons who were in close contact with the initial cases, which we have seen a large number of cases for. And we've also seen a large number of new cases, which demonstrates that there is a community transmission element that's ongoing. With respect to actually identifying any sort of event or any sort of actual behavior, we've really noticed a trend away from an actual site and actual event, so to say, to now generalized community transmission, which of course should be a sign and a marker to us to increase our vigilance in terms of practicing the 3 Ws. So thank you very much again, Priya, for that feedback, and we hope to see an improvement in the system within the next 48 hours.
Thank you very much, Dr. Richards. And just to advise, the additional numbers for Northwest Regional Health Authority for vaccine appointments are available on the Ministry's social media page and on the Northwest Regional Health Authority social media page. These additional numbers are 285-8988 or 285-8993. The extensions are 1205, 1231, or 1239. We go now to Newsday at this time.
Good morning, Narissa Fraser from the Newsday. My first question is, can the ministry say through which medium more of the appointments would have been made through, if through call or people showing up like we saw yesterday? If the data is not readily available, I'm fine with getting it afterward. And my second question, I know, Minister, you had said there is still no set date for the arrival of vaccines from Africa Medical Supplies. But I saw that Jamaica should be getting within the next 5 days. So I want to know if the talks have reached a point nearing setting some kind of date for that arrival for us.
Yeah, thank you. So I will take the second question first, and then we go to Davlin for the first one. So we are in daily contact with the African Medicine Council platform. We have asked them repeatedly for their sales contract because we cannot pay for vaccines until we have a sales contract based on a firm quotation. I checked up to this morning with the team managing that, and we have yet to receive the actual sales contract or firm quotation from African Medical Council platform. Thank you.
Thank you. We go to Mr. Thomas now, please, for a response to the first question.
Well, we actually are, the appointments that we've had for pre-registrations of NCD patients and staff would have been under 100 persons per day. The average numbers of persons who call or show up are over 300, just to answer the question directly. So there are over 350 persons daily who actually show up or call, and simultaneously the number of persons who basically have appointments per day are between 75 persons to 100 persons.
Thank you very much, CEO. We go now to CNC3.
Hi, good morning, Minister. This is Narissa for Guardian Media Limited. You mentioned earlier that there were side effects, no adverse effects, but side effects noted in persons who would have taken the vaccine, would have been administered, the vaccine would have been administered to yesterday. Can you tell us what side effects were noted? And in relation to the AstraZeneca vaccine itself, concerns have again arisen as to blood clots appearing in persons who would have taken that particular vaccine. Can you speak to those concerns again? And the last question is, can you remind the public what the wait time is during the first and second doses? Because we've had a report coming into us that somebody has been given an appointment for 3 months in which to receive her second dose. Thank you.
Let me go to Dr. Richards to respond. Thank you.
Okay, Annalisa, again, thank you for your questions. This really helps us in terms of our vaccine education drive. So I'll start with the question regarding side effects, which of course are different from adverse events, of which we had none. These side effects of the COVID-19 vaccine really are similar to any other vaccine, and the sort of side effects that we would have had with persons when we did some monitoring would have been, for example, body pains, a little bit of tiredness, malaise, or just general symptoms of the early onset of a virus. And what we found is that these symptoms really have resolved within 24 to 48 hours with no major issues. Of course, what we really look for when we do the 20 to 30 minute assessment with physicians on board and all the necessary precautions would be adverse events such as a severe allergic response or what we refer to as an anaphylactic response. The second part of your question dealt with the dosing regime for the AstraZeneca vaccine. And the CMO, based on technical advice and international evidence from the WHO, which of course is the international or global authority, has previously indicated that really and truly the gap between the first dose of the AstraZeneca vaccine and the second is between 8 and 12 weeks. From what have been observed or what has been observed and the guidance given to our healthcare workers in vaccine administration, we've advised a 12-week interval between the administration of the first vaccine and the second. So that sort of question that you asked from a member of the population regarding the 3-month gap or spacing period is accurate. Okay, so that is within the Ministry of Health's policy on vaccine administration. The third part of your question dealt with the concerns about blood clots. And yes, that has been noted in some countries. Of course, with any vaccine, there are adverse events that would have been noted. However, the risk or the benefits versus the risk of the vaccine are increased. Really, the benefits outweigh the risk for the administration of the vaccine. With respect to the blood clots, we have a system in place for monitoring persons who have been vaccinated, and so we would be noting if this occurred. Also, when we look at the actual incidence or the actual number of persons or percentage of persons who experience blood clots out of the total number of persons who've had blood clots, it's extremely small and very low as compared to other situations or other clinical situations that would result in blood clots. So thank you very much for your questions, and I hope this has provided some insight into the vaccine itself.
I just want to remind the public, and thank you, Annalisa, for raising that issue about the gap between the first dose and second dose. As the CMO would have said, and as all the international evidence has shown, when the AstraZeneca vaccine first came out, the interval at that point in time was 14 days, I believe. And then with time, with experience, and with new evidence, it went up to about 28 days. Now, as the CMO has explained, when you get the second dose after 8 to 12 weeks, the percentage protection actually goes up to the 90s. So that is the reason why we are recommending the 8 to 12 week window. So you are spot on when you said that somebody could have been given a return date for 3 months. It is actually well within the guidelines because the current evidence is showing that at that point in time, the efficacy of the vaccine actually crosses 90%. So you really raise a very important issue, and I welcome it and thank you for it.
Thank you very much, Minister. We go to TV6.
Morning, everyone. Urvashi from TV6. Minister, last week at a GSC, the CMO would have said that in order to achieve herd immunity, 1 million persons in TNT approximately would require vaccination against COVID-19. And that would be 2 million doses of the vaccine if we're talking about the 2-dose vaccine. How does government intend to fund this? Because we know the 6 billion will not be enough. The 6 billion allocated will not be enough. So how does government intend to fund this, given that at least the Supermarkets Association has said that there's been no sort of dialogue between government and them? That's my first question. Secondly, just to go back to Stephen's question, the Prime Minister was in fact confirmed with the virus just yesterday, whereas you've deferred all questions on his state of well-being to the Office of the Prime Minister. There's still a question as to the health care that will be afforded to the Prime Minister. Of course, he's in Tobago, and I think people in the country would like to know what arrangements are in place, how quickly can he be brought to Trinidad if need be, care in Tobago and so on. He is, of course, the Prime Minister of Trinidad and Tobago, and persons would have believed that all efforts should have been made to prevent him from getting the virus. Now that he does have the virus, the efforts being made to ensure that he gets that best health care. That's my second question. Thank you.
Okay, thank you. So funding of vaccines, as I have said previously, there's something called, when a cabinet notice pass, source of funds. We can fund vaccines, as I have said in this program, source of funds, loan funding via IDB. I have also indicated we have loan funding via the World Bank, and the Minister of Finance, if I recall correctly, about 3 weeks ago, indicated that the Ministry of Finance is also prepared to fund the vaccines, right? So those are the three major mechanisms, source of funding to fund the vaccines. In addition to funding vaccines, we are also getting some vaccines, like from India, 40,000. We expect 100,000 from China when that becomes available, which are at no cost. So the funding for the vaccines, the source of funds, when Cabinet approves funding, then you go for source of funds, could be loan financing or via the Ministry of Finance from whatever source they deem fit. On the issue of the Supermarket Association of Trinidad and Tobago, we are drafting a letter to the private sector. It is with the legal department to respond to them because the issues raised are more legal and technical than medical. The letters are being drafted, then they will go to the Honorable Attorney General for sign-off because they raise serious legal issues. So I'll be corresponding with them once the Honorable Attorney General signs off on the letter. On the issue of healthcare for the PM, that is being handled at this time by the Tobago Regional Health Authority, and his medical team will make all necessary arrangements for optimal care, whether in Trinidad or in Tobago, as they deem fit. Thank you very much.
Thank you, Minister. We go to Wired 868.
Hi, good morning, everyone. Fayola Bostic from Wired 868. My first question has to do with the members of the public who will wish to get their vaccines who are not in the NCD clinics, but they do have NCDs. How do they show documentation or prove that they do have NCDs and are eligible for the vaccine? My second question is whether or not the government has already received a quotation and paid for the second shipment expected of 100,000 or so vaccines from the COVAX facility.
Okay, so Mr. Thomas will take the first question and they'll come back to me for the second one.
Bonus area, you call the hotline at 378-4374. That's 378-4374. St. Joseph area and thereabouts. 378-3707. The Arima area and thereabouts, 380-1844. And for the La Hoqueta area, 380-1704. These numbers are also on the Ministry of Health website, along with the numbers that are available for calling for the other areas within Trinidad and Tobago. So make the call, make your appointments.
Thank you very much, Mr. Thomas. We go to Dr. Richard just to give some additional information and then to Minister, please.
So the current process, Fiola, that we are speaking of here would really involve the persons making appointments either by phone or walk-in. And during the clinical assessment, which is done prior to the administration of the vaccine, we would confirm, the clinicians and nurses, that is, if this person has a non-communicable disease or a chronic disease as per the Ministry of Health guidelines. What I can say is that the reports yesterday, which we were following at the Ministry, of the 1,153 persons, all persons fit the criteria. So I have to commend members of the population for being very honest in terms of their risk factors and, again, for their high level of vaccine acceptance.
Thank you. I will now, the question about payment falls directly in my garden. That's a policy issue. So let me explain the general process as to how Trinidad and Tobago purchases vaccines, as we have been doing for decades through the PAHO revolving fund. Okay, the first step is for PAHO to send us what is called a price estimate, which is what the term implies. It's an estimate of the price, but it is not the exact price, and we cannot pay on a price estimate. After we get a price estimate, which alerts us to the ballpark figure, then we have to get a quotation. It is only when we receive the actual quotation, which the price is now cast in stone, then we make a payment. So price estimate, we get a quotation. Once we get the quotation, we send the funds to the central bank. The central bank then sends the funds to the PAHO revolving fund. And then it is shipped. In the first tranche, we got the price estimate on a particular Friday. Normally, the actual quotation under normal circumstances will come 1 to 2 days after the price estimate. This being the first shipment from COVAX, it took us a week to get the actual quotation on which we can pay. So we got the price estimate, I believe, on a particular Friday. Then we were told we will get the quotation on the Monday. Didn't happen. Tuesday didn't happen. Wednesday didn't happen. Thursday didn't happen. We got it on the Friday. So it took us a week. When we got the price estimate on the Friday, we made the payment to the central bank on the Monday, and then central bank will then forward those funds to PAHO revolving fund. So that is what happened with the first shipment. The second shipment that you are asking about, we have not yet received the price estimate for the 77,000 doses, but it is going to be in the same ballpark figure of around $4.41 US per dose. However, you may recall I indicated earlier that CARFA had some grant funding to put towards vaccines. There was not enough time to apply that to that 33,000 doses. If we had attempted to do that, it would have slowed down the process even further. So that grant funding that CARFA has under the EU, we are now going to be applying it to the second batch. So the actual price that we may be paying for the second batch, because we have the time to facilitate that grant funding, may be actually less than the $4.41 US per dose. So I've given you the process. I have given you how it applied to the first tranche and how it is going to apply to the second tranche. Okay? Thank you very much.
Thank you, Minister. And now questions from Radio Tambrin.
Yes. Good morning, Clayton, Clarke, Radio Tambrin. With regards to the vaccine. Yes, good morning, Clayton, Clarke, Radio Tambrin. With regards to the vaccines, well, we were told that no children will be vaccinated. Has that decision still stand any consideration or thought of when children will begin receiving vaccination? That's my first question. And my second question, with regards to inter-island travel, particularly from the Port of Spain end on the ferry, we got calls about the whole protocol at the ferry. I myself traveled there, and there's concern about the social distancing and the way people are seated while waiting to board the vessel, and the whole awareness and sensitizing of persons as to the need to maintain the protocol, particularly with the holiday travel and the added movement between the two islands during this Easter time. So that's an observation and concern raised by persons. Those are my two concerns.
Thank you very much.
Thanks a lot, Mr. Clarke. Again, another excellent question that will increase our vaccine education drive. The Ministry of Health is guided by the WHO, which of course is guided by a very robust process in terms of the vaccine administration and all facets related to it. At present, there have been no conclusive studies regarding the impact of vaccination for children. And so the Ministry of Health continues to be guided by international guidelines, which really have not advised or do not recommend the vaccination of children. This additionally would apply to pregnant women. So those two groups at this point in time are not given the COVID-19 vaccine. The second question was referring to the COVID-19 protocols on board the inter-island ferry for inter-island travel. And this question, as per the Port Authority and NIDCO falling under the Ministry of Works and Transport, really should be directed to the Ministry of Works and Transport. What I will say is that, of course, the Ministry of Health will provide the required technical guidance and assistance to the Ministry of Works and Transport. So thanks again, Clayton. I hope this has answered your questions.
Thank you very much, Dr. Richards. We go to Express newspaper.
Good morning, Kimbo Drang from the Express. Minister, I will ask you to go back again to the PM and hopefully not ask you to encroach on anything you don't want to get into. But any update that you could share in terms of contact tracing and what may happen in terms of other members of cabinet possibly ending up being isolated, having come into contact in some form with the Prime Minister. Also directly, could you tell us whether or not the National Security Minister, Mr. Stuart Young, is in quarantine? Secondly, if maybe Dr. Abdul Richards could take this, while we checked around health centers yesterday on how the rollout of the vaccines was going, a lot of health centers, including, for instance, in Chaguanas, told us that they've seen a significant increase in people seeking testing from February to now, possibly because the figures are showing a rise and perhaps the citizens are being careful about checking on themselves if they experience any symptoms. So can you tell us if that trend is happening all around the country, more people wanting to get tested? Thank you.
Thank you, Kim, and I'll take your first question. So as per protocol, any person who is COVID positive, the contact tracing kicks in, whether it's the Prime Minister or anybody else, and the contact tracing will disclose to the contact tracers who needs to be tested or isolated or quarantined. I could tell you up to yesterday, Minister Young chaired the FNGP meeting and he was not in quarantine. I have no further additional information to share at this particular time.
Thank you very much. We go now to 98.1, please, for an additional question.
Yes, thank you again, Ms. Alcantara. And Minister Dayal Singh, I wanted to find out how that process is being rolled out, having to do with the actual recording of the vaccinations. Now, in any process, you know, one is always prone to human error. Is it that there is a hard copy, system together with a digitalization system, or is it just hard copy? How is that system to ensure that that we have the right numbers at the end, because we are working as against in line of targets with this initial 33,000 vaccines? Thank you.
Thank you very much. That's a very good operational question. The answer is we are doing actually both systems, I believe, but Mr. Davlin Thomas, who is more involved in operations, will give you a better answer.
So currently we're utilizing two systems, in parallel systems. One is the manual system where we're taking that information and logging the information of each person, but simultaneously we are using a digitalized, computerized system that is centralized as well, so that all the data is accumulated by the Ministry of Health as well, simultaneously. So during the actual vaccination process, two systems. One is a manual system where we actually provide we log the data from each person, which includes the demographic information, the clinical information, and so on. And simultaneously, there's the digitalized, computerized system, which as well is backed up both by the ministry and on site by the NCRHA and the other RHAs.
Thank you, Mr. Thomas. We go to CL Communication for a follow-up question.
Hi, good morning again. I was just wondering, the increase in the spread of cases on the east-west corridor, is it because of the congregating or because of the activities over the Easter Shelter Baptist and the holy celebrations? I was just wondering what was the reason behind the increase in cases, and if in fact you all were able to pinpoint such. Thank you.
Yes, Dr. Richards.
Yes, Ms. Singh. Again, what we've noted was that this increase in cases on the east-west corridor actually occurred prior to the Spiritual Baptist holiday. And what we're noticing really is an increase in community transmission. And so it can be linked just to a general commingling or mixing of persons with the virus. I'd like to really emphasize that approximately 81% of persons with COVID-19 are either asymptomatic, meaning they have no symptoms, or very mild symptoms. So these persons, we would commingle with them, we would interact with them socially or at the workplace, and that's really what is fueling the spread. With this in mind, we continue to advise members of the population to really practice all the precautions to reduce the spread of COVID-19, such as the proper wearing of masks and social distancing, and of course sanitization and washing your hands.
Thank you, Dr. Richards. And our question from TV6.
Thank you again. Minister, as it relates to the second vaccination, that's the second dose, last week you said that 2 weeks isn't a bad place. Now we're being told that 3 months is a good place. What happens if the India donation expected on Monday expires 7 weeks, just as COVAX did? Thank you.
Thank you. So, Urvashi, I really can't remember. And that is why I always stick to policy and let the experts talk on operations and technical matters. I remember the CMO saying distinctly that the CMO, not me, I repeated it this morning. I remember the CMO saying distinctly that the time interval between doses has increased according to WHO's recommendations and current thinking from 21 to 28 days to now 8 to 12 weeks. And I just repeated what the CMO said this morning. Let's not get ahead of ourselves too much. Let's wait until Monday, as I said before, to see what the expiry date is before we make firm decisions. Once we know that, then we could come to the population and come to the media and say, the expiry date is X, and because of that, the policy now moving forward will be Y. Okay? Thank you very much.
Thank you, Minister. And quickly to Wired 868.
Hi, good morning once again. Just a question about persons who already have a history of blood clotting issues, embolisms or deep vein thrombosis or anything like that. Are they still advised to take the vaccine?
So I'll take this question, and what we have recommended is that these persons assessed on a case-by-case basis, because of course there are several causes of blood and blood clots. Some are really chronic or long-term in nature, and some may have been acute or a one-off event. Some may actually be even a side effect of medication that a person may be using. As such, an assessment will be done by the physician and especially by their specialist, with a recommendation then being passed on to the vaccine administration team. I would like to reiterate and to emphasize that at the Ministry of Health, we are concerned about safety, not necessarily expediency, and these patients and persons will be assessed by their physicians. So thanks again, great question.
Thank you, Dr. Richards. And a quick final question from AZP News.
Hi, morning again, prior AZP News. Minister, yesterday after you got your vaccine, you drove out of the health center on your own. Some people are asking whether they should get some support when they go to get the vaccine, or if it's okay, to go by themselves. I don't know what is the medical advice on that. Thank you.
Dr. Richards will take that question.
So when it comes to medical advice, I will turn you over to the doctor.
At the health centers, we have a robust system for the observation or clinical observation of persons, and of course we are available to answer any questions that they would have. For persons who have mobility issues and so on, and the elderly, yes, of course, we would recommend that some sort of assisted transportation is provided by relatives. We actually have ambulances within a 5 km radius, or that are on call out, or we have ambulances stationed on site. A lot of our centers also have emergency doctors that are on site, and are close to accident and emergency rooms. So in response to your question about additional support, again, it would depend on the actual patient and their mobility, their ability in terms of transportation and so on. But we believe at this point in time, our precautionary measures are sufficient to really assess somebody if there is an issue. And of course, we have measures in place to mitigate risks. That is through the ambulance service system, the presence of A&E physicians or accident and emergency physicians that are at the sites. So thanks again, Prior.
Thank you very much, Dr. Richards. And we go to the Honorable Minister of Health, Terrence Deyalsingh, to close off today.
Thank you very much, Candice. And I really want to thank the media for your very erudite questions this morning. It clears up a lot of issues in the minds of the public. We take very seriously every concern that the members of the public have. These are your concerns and they are real. And we are here to address all. So we welcome the questions that come to us via members of the media. You are doing a wonderful job by raising these issues. As we close off, I just want to remind the public that in phase 1, we are vaccinating persons over 60 with comorbidities, most high-risk persons, both within and outside of the public health sector. We are vaccinating our healthcare workers. Once the vaccines come in on Monday from India, and we determine the expiry dates and all of that, there are already plans in motion to accelerate phase 2. Phase 2 will be people like essential workers, which includes government, opposition, councillors, and so on. However, right now, any member of parliament or senator who falls into the over 60 group with NCDs, they are free to access the vaccines because they are also a member of the public. But we'll be treating our special groups in phase 2 like police, defense force, army, fire, teachers, etc. with specified dates and times together with members of government, members of opposition, local government councillors, senators, etc. So when we get those doses in, we'll be going deeper into phase 1 and starting phase 2 concurrently, because it means in country we would have 40,000 extra doses. So we face up to the challenges, we acknowledge them. It was to be expected, but we are heartened by the turnout, we are heartened by the response of the public, and we continue at the Ministry of Health and the RHAs to build a resilient system to trust the vaccine. And I want to thank everyone who has made their contribution towards this drive in the recent past. In closing, it is incumbent upon all of us to wear our masks, to social distance, to wash your hands, not to congregate as far as humanly possible, even in your home setting, by inviting friends and family, and stay home if you are ill. We need to go back to that way we were a month and a half ago, because having a daily rolling 7-day average of 30 cases per day is a place we don't want to be. So thank you all for tuning in, and thank you Trinidad and Tobago and the media for your very good cooperation.
Thank you very much. We've come to the end. Have a good World Health Day, everyone.